The word pharmacopoeia means a book containing lists of drugs and methods of their preparation, in addition to their chemical formulas and uses. This term, pharmacopoeia, is a modern term, and there is no such a book discovered in Egypt, in ancient Egypt, belonging to the doctor's profession. But here, in these lectures, we use the term to describe the origin of various prescriptions and to describe their routes of administration and their doses as used in ancient Egypt. Therapeutic prescriptions recommended in the Egyptian papyri appear to be simple components. Simple components means that the drug was prepared from a single item, not a compound. Ancient Egyptian doctors used poultices, purgatives, enemas, pills, decoctions, and infusions for treatment. They prepared these drugs from natural constituents to lessen harm for patients from using drugs as far as possible. As regards types of drugs, there is no doubt that the prescriptions of ancient Egyptian doctors can be traced in the books of ancient Greek physicians, and such drugs which were of pure natural origin, either of herbal origin or plant origin or animal origin or mineral origin. These origins, which are natural, remained as such till the 15th century after Christ, when synthetic drugs started to appear in the field of treatment and became widely established by the 19th century after Christ. As for drugs of herbal or plant origin, they were derived from various types of herbs or plants, such as acacia, cassia, coriander, cucumber, cumin, fennel, fig, garlic, onion, hyoscyamus, juniper, lettuce, and others. As examples of drugs prepared from these plants, we know about castor oil from the resinous plant, opium from the red poppy, whose seeds were discovered in tombs from Fayum, hyoscyamine and hyoscine were prepared from mandrake, and 4 narcotic alkaloids were extracted from the lotus plant, which was considered by ancient Egyptians as a sacred plant. But as regards the common remedies of animal origin, they were honey, milk, blood, animal fat, liver, and meat. The last type of remedies, which came from mineral salts, were natron, which is a mixture of sodium salts, common salt, which is sodium chloride, malachite, which was used for preparation of the green eye paint, and lead sulfide, which was used for preparation of the black eye paint. Finally, let us describe the aspects of the pharmacopoeia, which are the routes of administration and the dosage. The routes of administration of drugs were different routes of administration. Oral administration in the form of pills or syrup, rectal administration in the form of suppositories or enema, vaginal administration in the form of suppositories or fumigation, or external local application to the skin surface in the form of poultice or ointments. As for dosage, preparation of compound prescriptions from more than one component. The measure of each component had to be specified exactly. And for this purpose, the figure of the Eye of Horus was used as a guide for this purpose. Regarding the doses given to the patient, they were assessed as volumes and not as weights. Ancient Egyptians did not use weights but volumes, and the smallest volume of a dose of drug was called raw, and this raw equals 14 milliliter.